April is Head and Neck Cancer Awareness Month, and here to tell us about the risk factors are Drs. Rajesh Kukunoor and Murali Murty with Ironwood Cancer and Research Center. Good morning, gentlemen. Good to see you.
Good morning. Good morning.
Dr. Kukunoor, tell me, what exactly is head and neck cancer, and how common is it?
Yeah, so head and neck cancer is, is the term used to describe cancers that start in the oral cavity, in the oropharynx, which is kind of your throat behind your mouth, and then, of course, the larynx, which is the voice box, and then going all the way up to the nose and the sinuses. So, yeah, as the picture shows, really starting from the nasal cavity down to, just above the collarbone area. All of these cancers are referred to as head and neck cancers. And the most common type of cancer in that presentation, we call it squamous cell cancer. About 65,000 cases in the United States every year, and about 13,000 deaths attributable to head and neck cancer. Head and neck cancer represents about 3% of all cancer diagnoses in the U.S.
Dr. Murty, what are some of the risk factors?
Yeah, so mainly it's tobacco use, alcohol use. Those are the biggest culprits. Tobacco increases the risk by 5 to 25-fold, and alcohol about 5 to 6-fold. Again, there's a dose response. What we mean by that is the more you smoke and drink or chew tobacco, the higher the risk of developing one of these cancers. Now, there's also a couple of viral factors. There's EBV, which is Epstein-Barr virus, and that's more common in Asia, which results in nasopharyngeal cancers, which is the area behind the nose. And then there's HPV, which is very common in North America and Europe.
So, doctor, let me ask you, HPV, does it cause head and neck cancer, and what's the prognosis of that?
Yeah, so HPV is now increasingly recognized as one of the more common causes, or very strongly associated with head and neck cancer. So about 70 to 80% of younger adult patients who really don't have any history of smoking or alcohol abuse, these kind of patients, when they present with head and neck cancer, almost 80% will be HPV positive. HPV is sexually transmitted and is recognized as a very common cause. Now, as far as the prognosis goes, the good news is HPV-associated head and neck cancer is very responsive to treatment, and the prognosis generally is far better than HPV-negative cancers. So even as you go from early stage to higher stages, about 80% survival rate for HPV-positive cancers, whereas for HPV-negative cancers, survival rate is much lower.
So if someone is diagnosed with head and neck cancer, how do you treat them?
Yeah, so in general, we use surgery, radiation, or chemotherapy. But it all depends on the location and the stage of the tumor. So if it's in the oral cavity, so in the mouth, on the tongue, etc., surgery is used first. But in other places, where, for example, the larynx or the back of the tongue, which is called base of tongue, where it's very difficult to cut that whole piece out, resect that surgically. So we use radiation and chemotherapy together with limited surgery at times. And radiation and chemotherapy, radiation is the mainstay of treatment, but chemotherapy potentiates the effects of radiation.
Okay, so let me ask too, what are some of the latest developments in head and neck cancer treatments?
So surgically, I mean, the field is evolving all the time, and surgically, they have minimally invasive techniques that are being developed and further refined. There's robotic surgery, laser resections, etc. Then, as I said, radiation is the mainstay of treatment, and so radiation, for the last 10, 15 years, there's something called IMRT, which is intensity modulated radiotherapy, which is a highly conformal way of delivering radiation to the tumor while sparing the surrounding areas. Now, when I say conformal, I mean this very, very focused. In the recurrent setting, meaning if the tumor came back in an area where radiation was given, we can use something called SBRT, which is stereotactic treatment. So again, delivering a very high dose of radiation to a very small area, very precisely in a very precise manner.
So there's various treatments out there, and which means a lot of hope for patients. So doctors, thank you so much. We appreciate it. And if you want to learn more about Ironwood Cancer and Research Center, you can visit their website, ironwoodcrc.com, or call the number on your screen.